So we're gonna assess how much function Nick's neck has. And this is, you've been having some neck pain, right?
Yep.
So head stays on the board. This right here is his neutral posture. It's about 0 degrees that way. So we can measure 3 different ranges of motion and essentially get 3 different amounts of function for each area of his neck. So I'm gonna have you start with your head on the board, tuck your chin as far as you can. Head stays on the board. He's at 25 degrees. He has great function at the top of his neck. So that would be a big indication for headaches. Now, hold that chin tuck, bring your chin down to here. Head leaves the board. Now here, as you can see, he's struggling a little bit. He's at about 44 degrees. He should be at 60. So he's missing a pretty significant chunk of function here. And if we go down, keep your chin right there at the sternum, bring your forehead towards the ground until the shoulder blades leave the wall. So that's right about here. This should be at 90 degrees down here, but it appears we're at about 65. So the lowest part of his neck, from here to the muscles right down here, we're looking at something about 72% function. So he's missing almost 30% of his function. And where are your symptoms at?
Have back pain right in the middle of my back.
So that's a reflection of the neck muscles that go that low are struggling to support his head due to all the technology use he has. So we're gonna go and fix some of that today. We have a lot of this going on, a lot of looking down at screens. We have these big muscles that come down from the base of the skull and plug in right down here. And a lot of times we'll say, oh, my shoulder's bothering me or my trap's bothering me. But ultimately, this is a neck muscle and its job is to support your neck, especially when you're looking down. If it's overworked, you get a big band right there.
Oh yeah.
Feel like a band there?
Oh,
When you
yeah.
go to the other side, you can feel the fibers. So it plugs into this muscle on your shoulder blade here. And once this gets cleaned up and we clean up some of his habits, this goes away. So what we're doing is we're peeling off layers of this adhesion that's acting like glue. There we are, we're about 72, so we gained a good 7 degrees there. How's the tension at the bottom?
Yeah, it's definitely not as much back in my shoulders. Feels like it's gone a little bit lower in the back.
Okay, so as we basically have our little list of problems your body will recognize, as we get rid of the top one, other things will slide up. So we'll just notice problems elsewhere.
Right.
And when it comes to neck stuff, your neck muscles stop right about there, so you might be looking more into the thoracic spine.
Okay.
But that's just another thing we get to work on once this is all cleaned up.
Definitely.